Welcome to our viewers from all walks of the healthcare world. Whether you're a doctor, a nurse, a chaplain, a technician, or anyone who interacts with patients, this cultural competency presentation is for you. This presentation is brought to you by the Council on American Islamic Relations Florida, and we're proud to be working in collaboration with the Hospice and Palliative Nurses Foundation. HPNF has played a wonderful role in propelling this cultural competency training forward, and we're so grateful for their partnership and support. Please note that this presentation does not constitute legal or medical advice. If you have questions or comments, please call our office at 833-224-7352, or you can email us at info@fl.care.com. This presentation is divided to make it easier to learn the content. The first portion focuses on creating a better understanding of Islam and Muslims, and the second portion takes that knowledge and shows how it can be relevant in medical spaces. Let's take a quick look at what we'll be covering in this portion. We'll explain a little more about the work CAIR-Florida does. We'll talk about why this type of information matters. We'll cover a section called Islam, Muslims, and You. And then we'll go into a better understanding of Islamic foundations in All About Islam. Next, we'll talk about patient etiquette, medical care, diet and medicine, and end-of-life care. At CAIR-Florida, we have multiple offices and staff throughout the state. This presentation is a prime example of one of the key areas of our work. We work within various systems of society, like the healthcare system, to educate on Muslim cultural competency. But before we start, let's address the why. Why does it matter? Well, we believe in the power of communication, and we believe that having these conversations builds bridges based on mutual respect and understanding. There's a growing number of Muslims in the U.S., and more people means more presence in the world of healthcare. In fact, Pew Research projects that by the year 2050, there will be about 8 million Muslims in the United States. And currently in Florida, there are about 500,000 Muslims across the state. So whether you're watching from Florida or from around the nation, and especially if you're in a metropolitan area where there's greater diversity in general, you'll probably see at some point of your healthcare career a Muslim patient. This could be someone at any stage of their life, from birth to end-of-life care. As healthcare professionals, it's critical to be sensitive to religious preferences while continuing to uphold the Hippocratic Oath. You have the unique responsibility of delivering medical care while also being sensitive to your patient's religious and cultural practices. Ultimately, better care starts with inclusive care. Being inclusive means viewing other backgrounds without judgment or prejudice, and going beyond that to embracing people's differences, and to the best of your ability as a healthcare worker, to including consideration of different cultural and religious preferences in your medical care. For so many people from various backgrounds, a medical crisis can be a spiritual awakening. It can certainly lead to a heightened commitment to prayer and religion, and the ability for a patient to comfortably lean on their spirituality is critical to their medical experience, and it's often an important part of their psychosocial betterment as well. Because of this and all these reasons, it's immensely valuable for healthcare professionals to study religious and cultural competency. Now let's focus on gaining a better understanding of Islam and Muslims. We'll define terms, cover demographics, discuss bias, and review both religious beliefs and cultural concepts. In the second section, we'll cover the application of those beliefs and concepts in medical care. All right, if you're ready, let's begin. We'll start with this basic definition. What is Islam? Islam is the second largest religion in the world after Christianity. It was revealed during the 7th century to the Prophet Muhammad, and while previous prophets were sent to specific nations, Islam teaches that its message was meant for all of mankind. It's important to draw your attention to the fact that Islam is a global religion, meaning there are Muslims in countries all over the world. The reason that's so significant to understand is that so many people limit their geographic perception of Islam to the Middle East, when in fact the Middle Eastern region makes up a minority of Muslims in the world. We'll address this shortly in a little more detail, but first, here's a little more on the underlying principles of Islam. There's so much to say about an entire religion, but these Islamic foundations are important to be aware of. Islam is a monotheistic religion, meaning it's built completely around the concept of one God. He has no mother, father, son, or anyone or anything equal to him. Islam also follows the Abrahamic faith tradition. Muslims believe in Father Abraham and the lineage of prophets that came from him, including Isaac, Joseph, and Jesus Christ, peace be upon them all, as well as Ishmael and the Prophet Muhammad, peace be upon them. Islam literally means to submit, meaning to submit to the will of God and to the worship of God Almighty. And from the root word of Islam comes the meaning peace and tranquility. That briefly covers what is Islam. The next question is, who is a Muslim? A Muslim is someone who follows the religion of Islam. That means they believe in the oneness of God, and that from the list of prophets sent by God, Muslims believe that Prophet Muhammad is the last and final messenger. A common mispronunciation is to say Muslim with a Z instead of Muslim with an S, and a common misnomer is asking a Muslim, "Are you Islamic?" So just like if you follow Christianity, you're a Christian, or if you follow Judaism, you're Jewish. If you follow Islam, you're Muslim. Noun and adjective. Hopefully that's clear, and with that, we can move on to discuss in a little more detail the convergence of religion and culture. Religious values and culture are very important to consider when dealing with Muslims. Often you'll find that a person's culture influences their religious practice, and as a point of reflection, this is true for many faiths. It's why you find Christians in the United States, for example, practicing their faith with different cultural infusions that might make it look slightly different than Christians in Europe or Asia or Australia. Here are some considerations when discussing religion versus culture. Islam is the name of the religion. Muslims come from almost any country in the world. Muslims belong to the same faith, and that is Islam, and Muslims have diverse cultural backgrounds. They're not a monolith, so you may find some variations in practices based on who's in front of you. Muslims have diverse languages. It could be any language, depending on their ethnic origin, and Muslims belong to different educational, political, and socioeconomic systems. For culture, we're going to use Arab as the example, particularly because there's so much confusion around this. Arabs have diverse religious affiliations. Yes, there are Arab Muslims, but there are also many Arab Christians, Arab Jews, or even Arab atheists. The native language for Arabs is Arabic. There are, in fact, over 420 million Arabic speakers in the world. Now, being Arab is a national identity, like being American, for example. Being American doesn't mean that you're Christian, it means you're from America. And being Arab means you're from an Arab-speaking country, specifically that you likely originate from the Middle East and North Africa region. Moving along, let's cover a couple of demographics related to Islam and Muslims. One thing that surprises many people is the fact that Arabs are a minority in the Muslim world. In live presentations, when we ask people to name Muslim majority countries, 9 times out of 10, we get a country from the Middle East or North Africa. But that region, the Arabic-speaking region of the world, constitutes less than 25% of the Muslims worldwide. The largest Muslim majority country in the world is Indonesia, with over 200 million Indonesian Muslims. The majority of Muslims are in the Asian subcontinent, which includes Pakistan, India, and Bangladesh. African Muslims constitute another major demographic of Muslims globally, and other countries with large Muslim populations include Turkey and Iran. Bringing it home here in the United States, African American Muslims are also a significant and important demographic in the Muslim world, and another growing group of Muslims globally and in the US are people who convert to Islam. Now let's talk about languages. Because Islam is a global religion, its adherents may speak any of the international languages. Besides English, the more prevalent languages based on population include Urdu, Bengali, Arabic, Indonesian, Turkish, and Persian. With that, we'll move on to a really critical part of today's presentation. Statistically, 60% of Muslims in America report having faced discrimination, and more than any other faith group that experiences religious discrimination, Muslims encounter this on an institutional level. In a 2020 poll on American Muslims, 25% of those who had faced discrimination indicated it was when they were receiving healthcare. And that's why this next section is so important. Let's take some time to understand the roots of bias against Muslims. We'll start with a breakdown of implicit and explicit biases. Implicit and explicit biases are the unconscious and expressed prejudices of other groups of people whose behaviors or beliefs do not align with our own sense of self. People naturally develop biases, knowingly or not, and sometimes we don't even know what the root of the bias is. But ultimately, those biases may manifest in the way we treat others without us even realizing it. There are so many factors that can lead a person to develop a bias or a prejudice against another person. And of course, this is a whole discipline of study in itself, but for the purpose of this presentation, we're going to quickly look at 5 key points. The first is history. The history of anti-Muslim sentiment is centuries old, and a lot of it stems from religious wars and the race for land expansion in different empires of the past. But even if we focus just here in the US, it's important to remember that different groups have been targeted from the birth of our nation. Native Americans, Irish, Catholics, Jews, Japanese, African Americans, and eventually the Muslim community. The second point is media. Media has been used heavily and very effectively to deliver misinformation or to focus on purely negative elements of coverage related to Islam and Muslims while ignoring the overwhelmingly positive contributions and impact that Muslims have in this country. The third point is Hollywood. Hollywood and the movie industry are responsible for promoting so many false stereotypes about Islam and Muslims. When people don't have a personal relationship with a Muslim, then yes, many are inclined to believe what they see and hear from the acting world. And that's really unfortunate because it's acting, and so often it absolutely does not represent Muslim religious or cultural values. The next points, then there's the issue of Islamophobia and propaganda. Again, this is its own presentation and area of study, but the bottom line is that there is an entire network of groups that receive millions of dollars to spread disinformation and propaganda about Muslims. They promote fear in society, and their impact is real. It's so important that we know the source of the information we're receiving and that we identify it as an objective source before accepting what we see and hear. Finally, we'll talk about experience and generalization. Perhaps we've had a personal experience with someone from a different culture whose actions were, in fact, inappropriate or unacceptable. But instead of attributing that negative trait to that person, we generalize it to that person's entire religious or ethnic group. These are common areas that are at the root of implicit and explicit biases that people have. Like we said, sometimes we don't even know we have these biases, or we don't consider what we might feel to be something negative. Here are some questions we'd like to invite you to ask yourself and reflect on. First, do I feel differently when I hear a patient speak with an accent? Or, am I surprised when an ethnic-looking person speaks perfect English? Perhaps, do I make assumptions about a patient's education level based on how they're dressed? Or when I see female patients wearing hijab, the headscarf, or niqab, the face covering, do I sense a negative feeling? If so, why is that? It's okay to sit with these questions for a little bit. In fact, we recommend that you do, because a lot of times we're quick to answer these questions in a way that we know is better or more culturally sensitive. But we want to take a moment to remind you that having an implicit bias toward another group of people doesn't mean we're horrible people. In fact, it means we're normal people, affected by media, messaging, or maybe our own experiences or stories of others. But to improve, to be more inclusive and culturally sensitive, it does require reflection, education, and intention. And by that, we mean the intention to be better and to do better. Right now, we'd like to invite you to pause this video and take a few moments to follow the link to Harvard's Project Implicit. It's a series of questions in various different areas that helps each of us understand our own selves a little more intuitively. When you get to the website, you'll find that there are lots of areas that you can test personal bias in, but we recommend that you take the implicit association test in these 2 areas. Arab Muslim IAT, and Religion IAT. We'll see you when you get back. When discussing diversity in healthcare with a focus on Muslim cultural competency, it's important to understand the basic foundations of Islamic beliefs, especially areas that may overlap with medical care. We'll address the 5 daily prayers, the Holy Scripture called the Quran and its significance in the life of a Muslim, particularly during hospitalization and critical care, views on illness and death, and family support. Let's start with prayer. Prayer and supplication are essential aspects of a Muslim's life. And just like you'll find people of many faiths praying in a hospital, if you have a Muslim patient, you'll very likely come across moments where the patient or their family are praying. There are 5 key areas of worship in Islam known as the 5 pillars of Islam, and prayer is one of them. These 5 prayers a day are designated at specific times throughout the day. They're comprised of a series of movements from standing to bowing to prostrating, and each position is significant regarding your stance before God. For example, prostrating is considered the closest spiritual position we can be to God Almighty. In fact, when Muslims are in this very humbling position, with your face lower to the ground, we say, "Praise be to God the Most High." And Muslims believe that this is the best position to pray and ask of God. I also like to point out that while a lot of attention is given to the Muslim prayer, if you study biblical tradition of past prophets, you'll find many instances from Genesis onwards of religious figures falling to the ground in prostration, washing before prayer, and even removing shoes for prayer. Some faiths still kneel or even prostrate in worship. And it's just interesting to draw these parallels because they help us see a similarity where otherwise before we might have only perceived a difference. Next, you may notice patients engaged in raising their hands and praying that way. More technically, it's called supplicating. And that's basically when a person is communicating, asking, thanking, essentially praying to God at any time, whether you're sitting, standing, walking, and you don't have to raise your hands to talk to God or to pray to God. And for reference, think about what the hand gesture represents. It's open hands, palms up, basically saying, "Lord, I have nothing and I'm asking you, I'm begging you to please help me." Keep in mind that medical circumstances and procedures might prevent Muslims from praying in the traditional way, and as a result, you may find someone praying in a chair or in bed. One patient we spoke to, it was in this situation, and she said, "After my surgery, I couldn't get up to perform the wash, and I certainly couldn't stand up to pray, so I prayed in bed. I did this for every prayer time until I regained the strength to pray the traditional way." Here are a few pointers on how to accommodate Muslim patients and prayer. Things you could provide include a prayer room or a worship area. Prayer rugs. This is great to have in common worship areas, but it would be so considerate to place a prayer rug in a patient room if you know that the patient is Muslim. And when Muslims pray, they turn to face the direction of Mecca. That direction is called the Qibla. So if possible, put something in rooms or in the chapel that shows the direction of Mecca. It's very simple to figure out. In fact, you can ask just about any Muslim staff member and they'll likely be able to help determine the direction of the Qibla. One physician we spoke to had a positive experience to share from her practice in New York. She said, "When I worked in Brooklyn, there was a dedicated prayer room for Muslims. Staff offered prayer rugs and knew where the Qibla was." Clearly, that was a wonderful display of cultural competency. Now, in terms of considerations, here are a few things to keep in mind. If you can, allow for some privacy if you walk into a room where a patient is praying. Don't walk in front of a person who's praying, rather try to walk around them if possible. And when a Muslim is in a state of formal prayer, then typically they won't respond to a question or conversation until they've completed their prayer. That could take a couple of minutes or longer, but an average prayer takes about 5 minutes. From prayer, we'll move on to discuss Ramadan, the Muslim month of fasting. Ramadan is a month in the Islamic lunar calendar. It's also known as the month of fasting. We mentioned that there are 5 core components of worship called the 5 pillars of Islam. Prayer was one that we discussed, and Ramadan is another pillar of Islam. During this month, Muslims don't eat or drink anything from dawn until sunset. That includes water, gum, and even coffee. I suppose because it's called the month of fasting, we've heard many concerned questions about how we survive a month without food or water. Well, obviously, we end our fast daily at sunset with food and water. And traditionally, Muslims break their fast on the dried fruit called dates, which is loaded with natural sugar, fiber, and nutrients to start replenishing the body after a long day of fasting. I'm sure many people in the medical community are familiar with fasting. It's certainly gained traction with doctors prescribing different variations of fasting to their patients. And when done properly, the month-long fast of Ramadan brings incredible health benefits. The last point on fasting is that it's a mandatory act of worship, but there are exceptions for those who have a valid excuse not to fast. For example, people who are ill or the elderly, women who are pregnant or nursing, they have the option not to fast given certain conditions. We'll talk more about this when we address the application of faith practices in medical care. Moving along, we'll talk briefly about a Muslim's diet in the context of what's generally allowed to eat or drink and what's not. In terms of what's allowed, religiously, all food products are permitted except if otherwise indicated. Keep in mind, though, that in times of necessity or preservation of life, even what's considered prohibited may be allowed. There are, however, specific things that are not allowed for a Muslim to eat or drink. They're religiously prohibited, and consuming them is considered a sin. So it's important to give attention to these things. The common areas are pork and all the ways that it's presented. For example, lard or gelatin in food or desserts, or porcine in medicine. Alcohol, which can be found in common medicines, often linked with the word elixir name. It's often found in mouthwash or just the drink in general. Any alcoholic beverage is religiously not permissible to drink. Regarding meat in general, many Muslims only eat meat that's prepared in accordance with religious guidelines. So, chicken or beef, for example, would have a halal label, halal meaning permissible, and that meat is often also known as zabiha, which is a word that's closely equivalent to the Jewish kosher. Some Muslims won't eat non-zabiha meat or meat they consider not halal, and that's particularly important for food services to be aware of so that proper alternatives can be offered. From diet, we'll move on to scripture. The holy book of Islam is called the Quran. Until today, the Quran remains in its original language of revelation, which is Arabic, but it's been translated into every mainstream world language. You may find people reciting in Arabic, reading the translation in English, or playing a recording of the recitation aloud. No matter the religion, scripture is often key to comfort, especially during trying times. There's a verse in the Quran that speaks to this, which reads, "Verily, in the remembrance of God do hearts find solace." So you'll find patients and their families increasing in their connection with the Quran, especially during difficult circumstances. So then we come to what are some ways that you can accommodate Muslim patients with regards to the Quran? Well, you can provide a Quran for Muslim patients and their families by having some in the chapel or bringing one to the patient's room. You can allow for Quran to be recited aloud or played through a speaker, and you can even offer that to the patient or their family because they might not know that that's an option. In terms of considerations, keep in mind that religious scripture is highly respected. It cannot be placed on the floor or in the bathroom, and it should always be in a clean place. And it's recommended not to speak or to speak in a low voice if Quran is being recited. The next topic we'll cover in this section of Understanding Islam is views on illness and death. Muslims view illness, suffering, and dying as part of life and a test from God. A common theme in the Muslim world is that trials to your health are a form of expiation or forgiveness of our sins. Sickness is also viewed as an opportunity for spiritual reward, particularly for those who are patient and acceptant of God's will. Being ill, is also viewed as a reminder to improve one's health. In Islam, we're taught that our body is a vessel that carries our soul in this world, and we're taught that our body is a trust that God gives us. It's our responsibility to take care of that trust, to treat it well, to not cause harm to it, and to strive to be healthy. Sickness is also viewed as an opportunity to come closer to one's faith, to turn to God, to pray more regularly, and to follow the tenets that sometimes we slip away from. Finally, when it comes to chronic illness or death, then it's part of the journey to meet God. Muslims, like many other faith groups, believe that life in this world is transient and that we're all working toward an eternal life with our Creator. You'll notice the information icon at the top right corner of the slide, which means that our resource page offers suggestions on further reading if you'd like to learn more about this topic. Finally, family support. During times of sickness and death, there's often a heavy emphasis on family support, encouraged by both religious teachings and cultural values. And while this certainly holds true during difficult times, it's also apparent during happy occasions, like if a person's in the hospital for the birth of a child. Especially when it comes to big families or strong social structures, you'll find lots of visitors coming through, whether to offer congratulations or prayers or condolences. A lot of nurses are particularly aware of this because they have the most interaction with the patient and with the visitors who come by. One nurse said, "I'm often surprised by the number of people who come to visit a Muslim patient. We try to make sure the patient has enough time to rest, and sometimes that's difficult with a regular stream of visitors." Of course, nurses have the task to make sure the patient is resting and well cared for, and a part of that might be simply asking the patient if they're okay and comfortable with visitors. A few other points to understand include that in Islam, it's considered a religious duty to visit and care for those who are sick, whether it's family, neighbors, or community members. There's a heavy emphasis on care and respect for the elderly as well, and all of this is designed to foster a culture where people look out for each other and where people feel cared for. Also, beyond religious teachings, there's a cultural, social obligation to tend to those who are sick. Here, we're just talking about cultural traditions, which might span various faith practices of the region. Additionally, you'll find that many Muslim majority cultures are defined by strong nuclear families. Often, this means that both religious and family insight are considered in medical care. As a healthcare provider, feel free to clarify with your patient whether they want family intervention as part of their medical discussion and plan. From here, we move on to the topic of patient etiquette. And in this section, we'll discuss things you might come across when caring for Muslim patients, from understanding the hijab to general issues of interaction. We'll start with appearance. The first point of interaction between healthcare workers and the patient is often visual. And it's common for Muslim female patients to wear a hijab, the same way it's common for Muslim males to have a beard. Of course, this isn't always the case, and we'll emphasize that a little more in the next slide. Let's start by defining some terms. Hijab. Hijab generally refers to the head covering that Muslim women wear. Depending on the part of the world a person is from, hijab can look different. A woman might wear it as a turban or as a loose shawl over her head, or the way you see me wearing it. And it's important to note that hijab also includes covering the body. You'll find that throughout the presentation, we emphasize modesty and patient exposure during medical care. So it's important to understand that hijab encompasses more than just the head covering, and that it includes the body as well. We'll pause for a moment here to explain hijab with a little more detail. Hijab is a religious commandment for Muslim women, and wearing the hijab is an expression of obedience to God. For many women, it symbolizes modesty. Even though hijab is a religious commandment, women have free will to decide whether or not they will cover. In cultures where this free will isn't allowed, it's important to know that those actions are culturally enforced and that they're not supported by religious teaching. When a Muslim woman starts wearing hijab, she'll cover in front of males who aren't related to her. So she won't have to cover in front of her husband, her father, brothers or sons, but outside of her nuclear family, she'll cover her hair and body. And that includes, of course, in front of men in the healthcare world, assuming that they don't fit into the family criteria that I just mentioned. Also, note that women don't have to cover in front of other women, so the situation is different for female doctors, nurses, chaplains, techs, food service workers, etc. All right, now back to our discussion on hijab. Let's talk about the niqab. Niqab is the face veil that some women choose to wear. Some women wear it as part of their interpretation of hijab or for additional piety. For others, it may be purely cultural and not religious. You'll find that niqab is more prevalent in some parts of the world, but largely it's viewed as an extra expression of modesty. A reflection point here: given our Western ideals of freedom and female liberation, it's important to be careful not to impose our personal ideals on someone else's choice to cover their hair, their body, or their face. It may be a unique perspective to hear, but for many Muslim women, hijab is incredibly liberating and represents all sorts of personal and social freedoms. There are lots of resources online that delve deeper into this topic, but for now, there's just one more point I'd like to make on hijab, and that is keep in mind that not everyone wears hijab or covers their hair. Many Muslim women do not wear hijab at all, but still, they may share the same cultural and religious preferences for modesty and privacy. So if you know that a female patient is Muslim, the best thing to do is ask her about any preferences she may have. Moving along to the male world, you might notice that some of your Muslim male patients have a beard. It could be a short beard or a very long beard. For Muslim men, keeping a beard is a religious recommendation that a lot of men uphold. It's based on prophetic tradition, and because of that, it holds a lot of religious significance for many people. And just like hijab, not all Muslim men keep a beard, of course. It's an important point of consideration, though, for patients who do, because it's part of their religious identity. And finally, looping in the beard to the conversation on hijab, our final point touches on our earlier conversation about implicit and explicit bias. The truth is, many people pass judgment based on physical attributes, like the beard and the hijab, and sometimes it's subconscious. So please remember to reflect on these issues and work toward gaining a better understanding of the person in front of you. Moving along, with regards to hijab and accommodations, healthcare workers should always prioritize a Muslim patient's request to wear hijab while receiving medical care, unless a medical emergency necessitates otherwise. This is from a New York Times article on respecting Muslim patients' needs. The article tells the story of a Muslim lady who went to a physician whom she trusted and told him, "I need to at least have my head covering on when I leave the operating room." When she woke up, she was wearing a gown, but her head was uncovered. She was livid. She had been there many hours. She will never go back to that hospital again. This really speaks to the fact that sometimes, even if a preference is communicated, it's not respected. And we understand that at times those requests aren't honored due to medical circumstances, and then it's understandable, of course. But other times, it's simply a lack of accepting the importance of a particular request. And to that, we emphasize that it's really critical to respect a person's wishes and to be culturally sensitive to their preferences, whether or not it makes sense to us and whether or not it aligns with our personal beliefs. In this presentation, you'll hear us discuss religious practices that align with what you'd call Orthodox Muslim culture, referring to Muslims who follow the faith in a more traditional, conservative form. It's important to understand this when discussing modesty and interactions between men and women. We've mentioned already that Muslims are not a monolith and that as a global religion, there are so many different practices. The next few slides are based on the perspective of a more traditional or orthodox practice of Islam. As a healthcare worker, you might encounter this heightened sense of modesty from male or female patients, especially when it comes to issues related to uncovering private areas. For example, one nurse made the following observation: "I remember once when a female Muslim patient did not let a male paramedic remove the urinary catheter. She also didn't let me look at her wound dressing because there was a male paramedic in the room at the same time. That happened to me twice or three times with Muslim women." Now, we've already said that medical necessity overrides religious rules, but when there isn't a medical emergency, then a patient's religious preference should be considered and respected. There are other areas of patient etiquette that go beyond the physical aspects of covering, but still qualify as expressions of modesty. Regarding patient interactions, here are some key things to consider. From an Orthodox Muslim perspective, physical interaction is not permitted between members of the opposite gender, and so you'll find that some Muslims do not shake hands with the opposite sex. In many parts of the world, and in America, we know that a handshake is a gesture of greeting and respect, but there are religious guidelines around physical interactions that some Muslims follow strictly. So remember that if a person from the opposite gender isn't comfortable shaking your hand, it's not meant to be offensive, even though it's often awkward for both people. The first advice we have is that if you're in this situation, know that it's nothing personal. And secondly, one thing we suggest that might help avoid an awkward moment is to consider allowing the patient or the patient's family to extend their hand out first, because of course, some Muslims do shake hands, and it may be easiest to let them guide that process. Alternately, in many Muslim majority cultures, people put their hand over their heart while they greet someone. It's a really common practice, and it's understood as a gesture of respect while maintaining physical space. With regards to hugging, sometimes hugging is a natural response to certain moments during times of extreme happiness or times of grief. Consider asking a patient if it's okay to hug them. They'll very likely understand the intent behind your question and even appreciate the consideration. Finally, let's talk a little bit about eye contact. If you've dealt with Muslim patients or their family members before, and this is especially true for immigrant families, you may have noticed that some patients look down and lower their gaze when they're speaking with a member of the opposite sex. Again, this isn't always going to be the case, but if you do come across it, here's why. Religiously, lowering one's gaze when speaking to someone of the opposite sex is an expression of modesty, and it's also meant to show respect to the person you're talking to. Of course, comparing that to the American concept of maintaining eye contact and the notion that if you don't look someone in the eye when you talk to them, it's disrespectful, it can make things really confusing, and it can easily be misunderstood based on the American social construct. So just remember that when you're assessing social behavior, eye contact avoidance should be understood in the context of modesty and respect. From here, we just want to make this important point, and that is that while more Orthodox Muslim women are inclined to express modesty in the ways we discussed, many men also follow the same rules of modesty in their behavior and in social etiquette. So now, in understanding how to best apply patient etiquette, we recommend these basic accommodations. Whether the patient is male or female, if possible, try to provide a same-sex healthcare worker to care for the patient. And where possible, demonstrate these points of cultural competency when you're interacting with patients. In terms of considerations, do not remove a lady's hijab unless it's medically necessary. And if you need to completely expose a patient, male or female, only expose what's needed of the body, preferably in sections, and only expose the body for as long as is needed, and then cover the patient up as soon as that need has passed. Additionally, don't shave a Muslim man's beard unless it's medically necessary, and if possible, make sure you discuss that with the patient beforehand. And finally, to offer privacy, it's a great practice to put a sign on a patient's door that says knock, announce, and pause before entering. That way, if someone isn't properly covered, they can quickly get dressed. It usually takes just a minute or less, but it's a very respectful gesture and a very sensitive expression of cultural competency. In this section on medical care, we will discuss the following: medical religious values, hygiene, women's health, specifically gynecology and obstetrics, psychiatry, and finally, transfusions and transplants. First, we're going to emphasize what we call the golden rule. It's simple and it goes a long way. The golden rule is show sensitivity for your patient's faith. When you, as a healthcare worker, take the time to let your patient know that you're giving them optimal medical attention while at the same time being sensitive to their faith considerations, that shows cultural competence. That shows empathy and emotional intelligence, and it shows that you care. At a basic level, this can be done by asking your patient, is there anything that I need to know about your faith related to your healthcare? Moving along, let's talk a little about medical religious values. There are so many, but we'll highlight three commonly referenced concepts in Islam that speak to overarching medical values. First, we have the teaching that stems from the Quran, which states that saving one soul is like saving all of humanity. Quite clearly, this emphasized the value of life and the importance of doing all that's within one's power to save a human life. The second point is medical necessity overrides religious prohibition. Basically, this value saying that even though there are strict prohibitions set place in Islam, those prohibitions are eased and even removed in the face of medical necessity. This is particularly important because religious teachings can influence medical decisions, and so understanding religious lenience in times of medical emergency is critical. The final religious value we'll cover is really a combination of the two previous points, and that is that in life threatening situations, saving a life is emphasized at any cost. So, here again, we see the emphasis on both the importance of saving a life as well as the permission to step outside the guidelines of religion in order to preserve human life. Next, we're going to step into areas of direct interaction with Muslim patients. Let's discuss issues related to hygiene. Religiously, cleanliness is heavily emphasized with teachings like cleanliness is a part of your faith. Now, side note, what you'll encounter in terms of cleanliness definitely will be influenced by certain factors like socioeconomic status and even individual culture. But regardless of who's in front of you and what their personal hygiene looks like, there are a few important points that Muslims likely share. We'll start by explaining the difference between something being dirty and something that's considered impure, which has a religious connotation. Dirty can refer to spilled food, dust, dirt, basically things that aren't pleasant but aren't intrinsically impure. Impurities refer to things like urine, fecal matter, semen, or blood. The reason this distinction is critical is because regarding impurities, not only are they dirty, but religiously they also invalidate your prayer and your state of cleanliness. So, on this point of hygiene, the emphasis is that if a patient has any of these impurities on them, like on their clothes, their bed sheets, it's not sufficient, for example, to wipe them down. To properly clean these items, remove the physical impurity from the patient's body or clothing altogether, replace the items that contain the impurities, and possibly offer the patient a chance to shower or wash up. And on that note, you might also notice that some Muslim patients wash their bottom with water after using the bathroom, and it's for the same reasons of removing or washing away impurities. Again, this is important for various reasons, including that impurities need to be removed in order for a person to be in a suitable state for prayer. Next, we'll talk specifically about women's health. There's a lot to cover here, so let's get started. There's usually a lot of modesty around the issue of gynecological exams, especially for young ladies and most particularly for women who haven't been married before. For background, religiously, premarital sex is not permitted. Again, that's the religious ruling, but as healthcare workers, you'll see a wide range of situations, of course. But it's important to note that because for many cultures, talking about sexual activity can be considered taboo outside of marriage. It's okay to discuss whatever you need to as a healthcare worker, but if you notice some discomfort or a quickness to say that someone isn't sexually active, that's probably why. Moving on, females who have never been sexually active may decline a gynecological exam, even if it's medically indicated. What we recommend in these situations is an open, clear conversation. A doctor or nurse should explain the risks and benefits as well as alternatives that might exist. Some young women or their parents on their behalf might decline some treatments, like the HPV vaccine, because they default to the notion that it's not necessary since the patient isn't sexually active and especially not sexually promiscuous. But staying on this example, it's important to offer education regarding the life saving protection that this vaccine provides and the fact that it's possible to contract HPV even when a patient is being socially and religiously responsible. In general, same sex healthcare worker is often preferred. But we say in general because, again, the Muslim community is not a monolith, as illustrated on this next slide, in which a Muslim female patient said, even in countries where Muslims are the majority population, we have male gynecologists, nurses, and all sorts of male healthcare workers. I understand that some people have a preference, but it doesn't matter to me. So you'll find a variety of preferences, and we'll pause for a moment to remind our viewers that Islam is a global religion with cultural influence from all parts of the world and made up of people with an infinite spectrum of personalities. But when it comes to cultural competency and sensitivity, we'll continue to focus on the general context and more likely instances you'll encounter. Moving along, let's shift the conversation slightly to obstetrics. In this section, we'll talk about contraceptives, abortion, pregnancy, labor, and nursing. From a religious perspective, contraceptives that are permanent, long term, or irreversible, like tubal ligation, are generally not permitted unless it's medically necessary. That means, for example, that if the life of the mother could be endangered by pregnancy, she can take permanent measures to avoid pregnancy. Reversible contraceptives and using physical barriers are the religiously recommended forms of contraception. Before discussing in which phases of gestation abortion is permitted, it's important to note that embryonic life has sanctity in all phases of development. The conversation around abortion is usually centered around two main phases of gestation: before 120 days and after 120 days. Before 120 days, religious scholars permit abortion in specific situations, including harm to the mother's life, rape or incest, or congenital deformities. However, after 120 days, the fetus is believed to have a soul, and a fetus, in fact, has its own rights in Islam. Abortion is permitted in exceptional cases, most commonly if the mother's life is in danger. To wrap up, we want to point out that regional culture as well as political views will often influence the expression of one's religious values. What does that mean? Well, culture certainly plays a role in religious understanding and scholarship, and so you may find people from certain regions of the world or people who lean in heavily to the culture around them might be influenced by the political or cultural discourse around this issue. At a basic example, women in the West generally exercise a lot more agency around their bodies and their rights. And this isn't meant to offer a religious opinion, it's just the way things tend to be. So, with regards to these sensitive issues, if you, as a healthcare provider, sense that your patient is hesitant and now hopefully understanding some of the religious guidelines that govern that sensitivity, it's often best to advise a patient to consult a religious scholar called an imam about the situation. On pregnancy in general, Muslim female patients are likely to request a female obstetrician. Again, this is likely for purposes of modesty and general comfort. Especially in cases where a woman chooses a female provider, but for whatever reason it's necessary that a male OB should see her, he should be made aware of the concepts of modesty and of issues related to hijab or her religious covering. During delivery, you'll find that women wear their hijab in a way that's comfortable for them. Some women may wear it fully, and while that might be perceived to be uncomfortable given the circumstances, if it's what they prefer, it's fine. Some women might not wear it at all, and other women might request something like a medical hairnet. The point is not to impose our ideas on what's comfortable or not to somebody else. On pregnancy in general, Muslim female patients are likely to request a female obstetrician. Again, this is likely for purposes of modesty and general comfort, especially in cases where a woman chooses a female provider, but for whatever reason it's necessary that a male OB should see her. He should be made aware of the concepts of modesty and of issues related to hijab or her religious covering. During delivery, you'll find that women wear their hijab in a way that's comfortable for them. Some women may wear it fully, and while that might be perceived to be uncomfortable given the circumstance, if that's what they prefer, it's fine. Some women might not wear it at all, and other women might request something like a medical hairnet. The point is not to impose our ideas on what's comfortable or not. Also, unless there's an emergency that requires that you rush into the room, if you can spare a minute, male healthcare providers should knock before entering the delivery room in case a woman who's observing the hijab isn't wearing it at the moment, or if she wants to adjust her clothing during labor. Even during delivery, some women will wear hijab fully or tied back or tied up like a turban, and some women won't wear it at all. And it may seem interesting that she's exposed in very private areas, but still chooses to cover her hair. Ultimately, the point here is that it's her preference and her choice, and it should be respected. One patient we spoke to said, I knew it looked funny. The anesthesiologist was administering my epidural. My whole back and behind were exposed, but I wanted to keep my hijab on. It just made me comfortable, and everyone respected that. Nursing is pretty straightforward. Nursing mothers will require more privacy due to exposure of the breast. And we've mentioned previously, in general, postpartum care, male healthcare workers should not announce themselves and wait for permission before entering a patient room. And although this seems usually to be the case, it's worthy of mentioning that lactation specialists assigned to nursing mothers should be female. That's going to be the general preference. But as is the case with everything we've discussed, you can always feel free to ask directly to see if the patient has any preference regarding gender, hijab, or any other issue. And finally, on this last slide under women's health, we'll address an issue that's come up in various spaces from patients to providers, and that's considerations regarding hijab and vitamin D deficiency in women who cover. Some studies have shown that lack of sun exposure due to modest stress may increase vitamin D deficiency levels. And even though studies are inconclusive, healthcare providers may want to discuss this issue with patients and share alternate ways to compensate, for example, through vitamins or through deliberate sun exposure. And on that note, some patients might think that sitting in front of a window is an easy solution, but glass blocks UVB rays, which increase vitamin D levels, but it doesn't block UVA radiation, which is harmful to the skin. So, specific education about healthy options is key. And that concludes the section dedicated to women's health. From here, we'll shift gears to the world of psychiatry and mental health. Psychiatry is such a critical area in general, and the most important thing to note here is that, in general, many parts of the world still have a lot of catching up to do in recognizing mental illness as an equally valid concern as physical illness. This is largely because of the cultural stigmas associated with psychiatry and mental illnesses. And in the next slides, we'll cover some of these issues, as well as therapy and medication and suicide. Cultural stigma on mental illness is international. It exists across the globe. And even though things have improved greatly here in the US, that stigma or prejudice is still very tangible here at home. The American Psychiatric Association states that more than half of people with mental illness don't receive help for their disorders, or they avoid or delay seeking treatment. Often it's because of concerns of being treated differently or fear of prejudice and discrimination. In some cultures of the world, mental illness is viewed as disgraceful and a shame to the family. While there are some shifts in perception of mental health and the attention it deserves, there's still a lot to overcome. So, as healthcare providers, it's important to recognize some key things regarding diagnosing and therapy. Even discussing mental health can be considered a taboo and might quickly be shut down by the patient or their family. Mental health misconceptions include the idea that struggling with mental health is a sign of weak faith, and even that mental illness is a Western phenomena. So, when you move on with the patient to discuss therapy and medication, there may be resistance to non religious intervention, such as therapy and medicine. Encourage patients to seek mental health care the same way they would seek medical care for a physical ailment. It's probably really frustrating to diagnose a patient with a mental health illness and to have a plan of therapy and medication and then to face resistance. But one of the best things to do in these cases is to help the patient understand that mental health issues are caused by physiological and hormonal imbalances that are often out of their control, the same way that these issues might affect their physical health. Being patient in these discussions and understanding the very strong and detrimental cultural stigma associated with mental health issues can help. But ultimately, drawing parallels between mental and physical health helps the most. Finally, consider incorporating a referral to a Muslim mental health counselor or a Muslim chaplain if available. Sometimes speaking to someone who shares a cultural understanding can help move the conversation forward. Next, we'll touch briefly on suicide. Suicide is a hard topic to discuss for anyone of any faith or no faith. In Islam, life is considered a sacred gift from God. As such, suicide is categorically forbidden, and this is stated very clearly in the Quran. Things that are forbidden in Islam are generally also subject to punishment in the afterlife, unless God Almighty forgives one's sins. Because the teachings against suicide are so clear, some patients with suicidal ideation might experience complex challenges navigating both psychological and religious realms. If you're facing a situation like this, we recommend referring the patient to a Muslim mental health counselor or Muslim chaplain if available. Reading more about this issue is also critical. On our resource page, we've included an article from JAMA Psychiatry titled Suicide Attempts of Muslims Compared with Other Religious Groups in the U.S., co-authored by Dr. Rania Awad, one of the leading American Muslim mental health experts and director of the Muslim Mental Health and Islamic Psychology Lab at Stanford School of Medicine. Her social media links are also included in the resource guide. Transfusions and transplants. Life is very valuable in Islam. To save a life, medical workers should do whatever is necessary in emergency situations if it does not violate the patient's wishes. Both blood transfusions and organ transplants are generally acceptable. This is really straightforward, but there are a couple of questions around blood transfusions and organ transplants that often come up within Muslim circles, and basically, just know that blood transfusions and organ transplants are permitted from any person, regardless of their faith background. And that if you do have a patient or a family member who's hesitant to receive either of these for any reason, just encourage them to speak to a religious authority for clarification. Organ donation is slightly different. There are various religious opinions around organ donation. Some jurisprudence allows it, others have conditions around it, and still others consider it not permissible. Most people who sign up as organ donors would have done their own religious research first, but some people might not have considered it at all. And the key point here is that healthcare workers can suggest that a patient donate their organs, but stay sensitive to the different opinions regarding the permissibility, so keep it at that, just a suggestion, and let the patient navigate it based on their religious leaning and comfort. All right, next we're moving into an important section regarding the Muslim's diet and the extension of that significance from food to prescribed medications. There are certain items that Muslims are religiously not allowed to consume, and we'll review those in the next slide. In this section, we'll cover Muslim diet regulations, fasting in Ramadan, medicine using non-halal ingredients, and alternative medicine. Here's a breakdown of permissible food and drink in Islam. The general rule is that food products are permitted unless otherwise indicated, but regarding items that are not permitted, it's important to note that in times of necessity or preservation of life, prohibitions are relaxed and things that are prohibited become permissible. Regarding food and drink that are not allowed in Islam, the stipulations are pretty clear. Here's a list of the items that are not allowed for Muslims to consume. Alcohol or anything that contains alcohol, including all alcoholic drinks, and even common medications with elixir in their name or in their ingredients. Pork, which encompasses all things that come from a pig, whether it's lard, gelatin, bacon, ham, or porcine-based medicines. Some Muslims will also refrain from eating any meat that is non-zabiha, which is also known as non-halal. Basically, this is meat that's not prepared in accordance with religious guidelines, similar to kosher guidelines for the Jewish community. Some exceptions to these dietary rules are kosher products, which are okay to consume in any form, meaning Muslims who follow a zabiha-only diet, which again is meat that's slaughtered according to religious guidelines, can have kosher as an acceptable alternative. Side note, Jews and Christians are given a unique status in Islam. They're referred to as people of the book because of the shared Abrahamic tradition and because of the revelation that their respective prophets received. So Muslims are permitted to eat meat prepared by people of the book. Another exception, as you've heard us mention before, is during critical circumstances. During those times, whatever it takes to preserve a life takes priority over religious restrictions. If it's possible to address these options with a patient beforehand, meaning before a potential emergency, then a healthcare provider should do just that. Fasting is one of the pillars of Islam. It's a core act of worship, and because of that, Muslim patients may feel hesitant to skip fasting. Healthy adult Muslims are obligated to fast every day for 30 days from dawn until sunset. Fasting during the Islamic month of Ramadan means abstaining from any food or water or anything with nutritional value that enters the body in any form. There are some categories of people who are exempt from fasting or can choose to fast depending on their health and ability. Kids, for example, don't have to fast. Religious accountability in Islam starts at puberty, so before that, acts of worship are not mandatory. Also, Muslims who are ill or the elderly don't have to fast if it's difficult or unhealthy for them. And finally, pregnant or nursing women have the option not to fast if they feel like fasting will adversely impact their health or their baby's health. There are certain conditions around these exemptions, but the main point we want to deliver is succinctly summarized in this quote. Islam is based on ease. The slightest discomfort or harm to patients removes religious restrictions, especially if there are no appropriate alternatives. This is the underlying rule. This applies to any situation, but let's take pregnancy and diabetes as two examples. Many Muslim women adjust their nutritional and fluid intake to accommodate the hours in the day during which a person can eat or drink in Ramadan. And for many women, it works just fine and they don't have any problems. Or they'll push through a little extra fatigue for the sake of maintaining the fast as long as it doesn't bring harm to them or their fetus. But if a woman is going through morning sickness or feels overly exhausted, or she senses that she's not getting enough nutrients for her or her baby, then she has the option not to observe the fast. With regards to diabetes, one geriatric specialist we spoke to shared what she usually does for Muslim patients in Ramadan. She said, "For my Muslim patients during Ramadan, if it's appropriate for their care, I either reduce or take them off insulin while fasting and monitor them. But if they're brittle diabetic, for example, I don't recommend that they fast." We'll spend a little more time discussing the potential effects of fasting on diabetic patients in case this comes up. Naturally, diabetes can introduce complications for Muslims who are fasting. Because of this, the patient has religious exemption and does not have to fast. We do want to point out that while breaking the fast is permissible, it shouldn't be an easy solution. So healthcare providers shouldn't default to, well, just break your fast because your religion says it's okay. You'll likely find that patients themselves may want to try every avenue that might allow them to fast, even if it's on intermittent days. And we encourage healthcare providers to work with them and accommodate that preference if it's possible and safe. But if not, here are a few reminders. Muslim patients may be encouraged to refrain from fasting for a few days or for the entire month if needed. If a patient develops hypoglycemia, they should be provided supplements. And finally, patients should not fast if blood glucose levels fall to dangerous levels. Now, whether you're a member of nutritional services, a nurse, a doctor, or anyone who deals with food or medication, here are a few considerations on how to accommodate Muslim patients and fasting. First, when preparing for the fast, encourage pre-dawn meals that include carbohydrates that release energy slowly. Second, remember that fasting restrictions aren't just things we eat or drink. Anything that enters the GI tract or offers nutritional value is not permissible while fasting. This includes inhalers, nebulizers, suppositories, oral medications, and dental care. Here's a unique point for consideration. Even donating blood is not permitted while fasting because even though it doesn't enter the GI tract and it doesn't offer nutritional value, It may lead to a person needing to hydrate or eat, which basically means they'll break their fast. Third, when prescribing or administering medication, if possible, adjust the time that the patient has to take the medication. And remember, communication is key. If medical options are flexible, ask the patient about their religious preference regarding fasting and medication. Moving along on the topic of medication, let's look into issues related to medicine and certain ingredients to look out for. This section is on medicine using non-halal ingredients. Remember that halal means allowed or permissible. So we're talking here about medicines that contain non-halal ingredients or ingredients that are not allowed for consumption. Outside of the actual medicinal chemical component of a medicine, most people don't pay attention to what might be considered irrelevant ingredients. But it actually warrants consideration, especially in the case of Muslims or other faith groups with dietary restrictions. Here's an example from a doctor we spoke to illustrating why it's important to know and inform patients of medicine's ingredients. He says, one of the more common hypothyroid medicines, Armour thyroid, is derived from porcine thyroid glands. Many people don't know this, and it would be appropriate to offer a non-porcine alternative that treats the same condition. So yes, as the doctor suggests, it would be very appropriate to offer an alternative if one exists. Some other common restrictions found in medicines include gel capsules. They're so common, yes, but they also very often contain gelatin. Doctors have recommended looking for non-pork, vegetarian, or vegan alternatives. Next, we have elixir. Now, elixirs are basically sweetened hydroalcoholic liquids, and many people, particularly patients, don't think alcohol when they get something like Tylenol elixir. In fact, a lot of common medicines like cough syrups contain alcohol, and these certainly fall within the category of prohibitions, especially if there are other alternatives. Other common non-medicinal items with alcohol include, for example, mouthwash. Those alternatives are really easy to find, so it's important to be aware of these issues and to offer those alternatives. Finally, there are some medicines that are porcine-based that might be injected, not ingested. An example of that would be a heparin shot. After patient safety, the most important thing to consider is patient education. Patients should be informed if the medicine being prescribed contains restricted ingredients, and they should be given the option to choose an alternative medication where possible. Even in the example of heparin, which is injected and not administered orally, some patients may prefer a low molecular weight heparin, which is not porcine-based, if appropriate. Next, we move into alternative medicine. These are traditional medicines and both religious and cultural remedies that people take regularly or when they're sick. There are so many examples, depending on what part of the world a person is from, but here are some that you'll find very commonly used among Muslims because these things like honey, olive oil, dates, black seed, and cupping all stem from religious teachings that heavily stress their benefits. Patients can be asked about their use of alternative medicines to identify possible contraindications, drug interactions, or side effects. Other examples of commonly used products that may interfere with prescribed medication include grapefruit, witch hazel, or St. John's wort. Let's move to the last section of this presentation, end-of-life care. Cultural competency is a core skill required for end-of-life care. During these critical times in a patient's life, religious and cultural beliefs heavily influence medical decisions. With this understanding, palliative care and end-of-life clinicians should have at least a basic understanding of world religions, including Islam. We'll start this section discussing the religious context of issues surrounding beliefs and behaviors during these critical times. We'll talk about the difficult process of ending life support. We'll discuss beliefs around death and what comes after it, and we'll wrap up with a brief discussion about funerals. Regarding religious context, a key Islamic principle of belief is the notion that God created us, that we belong to Him, that this is a transient life, and that it is a test, and that we should all be working to gain God's favor because ultimately we will all return to Him. This concept is summarized in a verse from the Quran that reads, "To God we belong, and to Him we return." You'll probably hear people say this to family members of a person who passes. It's meant to encourage patience and submission to God's will. And it also reminds people that life is transient and that we should live in preparation for an eternal afterlife. Here we'll talk about some things you may notice from your patient regarding end of life feelings, emotions, and beliefs. On the topic of acceptance, you'll find that often patients mentally and emotionally prepare for death. As we mentioned, there's the religious principle that we belong to God and we return to Him. So begins the full resignation to God's will. And on the topic of suffering, pain and misery are not punishments for one's sins. Rather, as we mentioned earlier, they can be an expiation or forgiveness of sin and a way to gain closeness to God. Also, with suffering, there's the promise of great reward for those who exhibit patience in the face of affliction. Now, regarding fear of death, in Islam, there is strong emphasis on personal accountability, and the concept of salvation doesn't exist. Muslims believe that all of our actions in this life will be judged by God and that we'll be rewarded or punished accordingly. And on this point of fear of punishment, Muslims believe that if someone sincerely repents, personal mistakes can be forgiven by God's mercy. But the concept of justice is heavily and consistently emphasized in Islam, and injustices against others require that the person who was mistreated forgive the one who committed the injustice. Injustice is a big word, but it applies to things that are sometimes small. Theft, for example, is an injustice, but so is slander or gossip or wrongfully taking advantage of one's position of power or cheating. And so you'll find that people in this stage of life may seek forgiveness and redemption with others. Common things you might notice during end of life care include having an influx of visitors, an increased recitation or playing the Quran, increased prayer and supplication, seeking forgiveness from others whom one may have wronged, and paying off debts. During these critical times, remember that cultural and religious competence is critical to provide effective comfort. Try to balance visitors with the patient's need for space, especially if the patient communicates that's what they want, a break from visitors. Provide a Quran and accommodate a space to pray, a prayer rug, and Qibla information, which again, Qibla is the direction for prayer. And finally, allow imams to provide support to Muslim patients and recruit Muslim imams if possible. When it comes to ending life support, this is, of course, an incredibly difficult issue to navigate for all those involved: patient, family, physicians, and healthcare workers. From an Islamic perspective, there are some key considerations regarding intervention. Specifically, let's address withholding versus withdrawing medical care. There's withholding, meaning not initiating a life sustaining intervention. And then there's withdrawing support, which obviously means stopping the life sustaining intervention after it's been started. Religiously, withdrawing intervention is more contentious than withholding it. The religious debate focuses on whether or not and when it's okay to withdraw life sustaining measures. And the primary religious recommendation is to discuss the patient's prognosis with them or their family before any procedures or need for intervention, so that a plan that accommodates religious values is in place. When it comes to nutrients versus treatment, there's also an important distinction between the purpose behind some life-sustaining measures. For example, life-sustaining measures include artificial nutrition and hydration. If delivering nutrients via tube is considered feeding, then it's not permitted to remove it, as that's considered starving the patient. But if delivering nutrients is viewed as a medical treatment and the patient is at a terminal stage with little hope for recovery, then it's permissible to remove such life-sustaining measures. Still, the decision to withdraw life support, whether it fits the religious criteria or even regardless of religious perspectives, is such a sensitive and emotional part of medical treatment. People of faith are generally taught to be hopeful and to have faith in God's ability to do all things and change all circumstances. And sometimes that hope, that praying for a miracle, that trust in God doesn't align with the objectivity of science. Similarly, we've spoken to family members of Muslim patients who expressed a lot of frustration around what they perceive to be callousness or insensitivity to their wishes to hold on to their loved one and wait for a positive turn or wait for a miracle. The wife of one patient who passed shared this sentiment with us. When my husband was in an induced coma with a poor prognosis due to COVID, the doctors explained that he wouldn't make it. The next day, they sent a different doctor to speak to me. I broke down, telling her I'm tired of them pressuring me to send him to hospice and that it's their job to respect my decision. Everyone was praying for him to pull through. How then could I ever tell my kids that we're pulling the plug on dad? Moving along to DNR orders, they should be honored per standard procedure. Regarding euthanasia, regardless of the incurable or debilitating nature of a disease, it's never Islamically appropriate to take one's own life, even if it's to save them from suffering. We'll wrap up with a discussion of how Muslims view death and common protocol after a person passes. At the moment of death, Muslims believe that the soul leaves the body and is in a transitional state until Judgment Day. Before a person passes away, you'll find many Muslims playing or reciting Quran next to the person who's transitioning out of this world. And in the final moments in particular, the dying person will be encouraged to repeat what's known as the Shahada, which is the testimony of faith in Islam. It literally reads, I bear witness that there is no God but one God, and that Muhammad is the messenger of God. Muslims try to have these words be their final words in this life. Also, a patient's suffering should be relieved to the maximum extent possible. After death, the eyes of the deceased should be closed, the body should be covered, though viewing is permissible. The body should be wiped down, but left intact to the extent possible. Lacerations should be sutured, and wounds should be closed to avoid fluids from leaving the body. Loud lamentation like crying, screaming, or being physical, all of that is prohibited in Islam, though culturally and even from a simply humanistic perspective, you may find some people doing that. It's important to note that cremation is not allowed in Islam, so if you have a patient who is Muslim, unless that was their personal request, then all measures should be taken to avoid cremation. Also, autopsies are not acceptable unless necessary. The Islamic tradition is to bury the deceased as quickly as possible. Most people will try to complete the burial on the same day, but if that's not feasible, then they'll aim to do so within a couple of days. The body should be sent to a funeral home for the required ritual washing before burial, and this washing is typically completed by the imam or members of the local Muslim community. And that brings us to the end of our presentation, which takes us all the way through to the final stages of medical care. As we move into our summary slide, there are a few important reminders I'd like to share. First of all, there's a lot of material here, and no one expects you to be a scholar on all the faiths that you encounter, but taking the time to learn about the faith practices of your patients shows that you are culturally considerate and respectful of their faith. It means a lot to patients when their healthcare providers are willing to accommodate their beliefs where possible. Second, proactively discussing with your patients the options that they have communicates that they have agency to request accommodations, and some people wouldn't otherwise know that that's an option. And finally, being culturally knowledgeable and considerate can completely change a patient's clinic or hospital experience. It makes you all around an impressive professional, and that's a great rep to have. So in summary, remember that when you're facing a situation that you're not certain how to navigate, refer to a Muslim chaplain or a local religious leader. Check resources from verified religious and professional websites. Remember that Muslims are not a monolith. They may have many different cultural influences and religious beliefs, and sometimes it's best to ask them about their personal preferences. Inform your patients about issues that you know contradict their religious practices and offer alternatives if available. And once again, know that you are not expected to be an expert in these religious matters. Having a general understanding, an open mind, an open heart, and clear communication are key. There are two main resources we want to leave you with. One is a summary one-pager on caring for Muslim patients, and the other is a resource guide with links to articles and studies that were referenced throughout the presentation. If you're interested in further reading about these topics, please take a look at these additional resources. Finally, please share your feedback with us. You can scan the QR code on the screen, or you can follow the link bit.ly/CAIR-survey, and remember that it's case sensitive. Take a moment to visit our website and learn more about what we do. Our contact information is on the screen. Please reach out to us if we can be of any assistance to answer questions, offer clarification, plug you into community resources, or to plan an in-house training for your clinic or hospital staff if you're in Florida. We certainly look forward to connecting with you. And with that, on behalf of CAIR-Florida and the Hospice and Palliative Nurses Foundation, thank you very much for joining us.